Oncology in Turkey. Cancer treatment is one of the most common requests from foreigners. People call Healthy Turkey with such requests several times a week. In this video, we'll discuss Oncogynecology in Turkey. It's a medical branch that treats tumors in the female reproductive system. We'll show a clinic where patients with such diseases are treated and meet a surgeon oncogynecologist who consults in Antalya, Turkey. Discuss treatment methods, stats and success factors, and probability of preserving reproductive function. Subscribe, ask in comments. All about medicine in Turkey on the channel. Oncogynecology deals with the treatment of malignant and benign neoplasms in female reproductive organs. In other words, oncogynecologists treat cancer and other tumors in the uterus, vagina, ovaries, cervix, and so on. Many women sooner or later face the appearance of such neoplasms, and they worry not in vain. If the tumor is not diagnosed in time and allowed to progress, the consequences can be fatal. Therefore, medical professionals strongly emphasize the importance of regular preventive checkups. If we manage to detect the presence of oncological formation at an early stage, then of course in many cases, the disease can be effectively and permanently eliminated. And due to late detection of oncological disease, we prescribe treatment that can potentially prolong and improve the lives of patients. Dr. Fatih Dencher is a surgeon oncogynecologist at a hospital considered one of the leading oncology centers in Turkey's medical system. Studied at universities in Ankara and Izmir, underwent specialization and worked in many major cities of the country. On occasion, even at a more advanced stage, cancer can be eradicated through surgical intervention. If surgical intervention is not possible, the patient is managed by utilizing radiation therapy or chemotherapy as alternative treatment options. Female reproductive organ cancer is a large group of diseases. Do they all respond to treatment equally effectively? For example, cervical cancer. This is a type of cancer that can be prevented if diagnosed at an early stage using biopsies, smears and HPV tests, or human papillomavirus. This is a type of cancer that we can completely cure through surgical means. Another disease is uterine cancer, which develops in the endometrium. It can be diagnosed at early stages using surgical biopsy procedure. This tumor can also be eliminated through surgical intervention. If he continues to progress after the surgery, we can prescribe radiation therapy and chemotherapy. But once again, I reiterate that the majority of diseases can be treated through surgery when detected early on. On the other hand, ovarian cancer develops in the abdominal cavity in a rather insidious way. It is typically diagnosed solely at a later stage, when there is bloating of the abdomen and accumulation of fluid in the abdominal cavity. It is very important to remove the entire tumor in this area. Unfortunately, there are very few satisfactory results in the late stages of ovarian cancer treatment. This is not only in Turkey, but also worldwide. Turkey is known in the medical world for its local surgeons preferring minimally invasive surgical methods. In each case, when the patient's condition allows, the Turkish doctor will choose the most gentle method of intervention. Doctor, what surgical techniques do you favor when treating patients with oncological conditions? It relies on the type of disease and the patient's overall health status. Laparoscopy can be done in the uterus for patients with endometrial cancer. It helps in reducing the patient's pain, shortening the hospital stay, and minimizing the risk of thromboembolism. Laparoscopy can also be carried out in the initial phases of ovarian cancer. And in more advanced stages, we tend to opt for performing an open surgery. Tell me, how can a woman suspect that she has cancer of the female organs? For instance, bleeding after sexual intercourse is a warning sign indicating the presence of cervical cancer. If bleeding happens subsequent to sexual intercourse, a woman must definitely consult a gynecologist. Regarding uterine cancer, our typical method of diagnosis involves performing a biopsy. Once a year, women should undergo a gynecological examination. If a patient comes to us for an examination and we notice an increase in the thickness of the uterine wall, or sometimes in women who skip examinations, there may be heavy bleeding. In these cases, we can diagnose the disease at an early stage with the help of endometrial biopsy. The endometrium is the inner mucous membrane of the uterus. She regularly updates during menstruation. If the endometrium grows abnormally, it leads to certain types of tumors, both inside and outside the reproductive organs. These tumors can either be malignant or benign, but it is imperative that they are eliminated in any case. Some diseases, such as cervical cancer, can be diagnosed at an early stage with the help of an annual HPV test, which stands for human papillomavirus. Cervical cancer can be prevented with the HPV vaccine. We highly recommend vaccinating all women against HPV to reduce the risk of developing this type of cancer. HPV, or human papillomavirus, is a general term for in excess of 200 different types of viruses. A characteristic sign of infection is the appearance of warts on the skin and genitals. The fact is that human papillomavirus viruses multiply in flat epithelial cells. They enter the body through microtraumas and cracks in the skin. That is why viruses often infect during sexual intercourse. This can lead to the development of tumors of the reproductive organs. What is the statistics of restoring reproductive functions after treatment of this type of cancer? In most cases, uterine cancer and ovarian cancer typically develop in women at an older age, when they no longer desire to have children. However, cervical cancer can develop in young individuals, and patients with this condition can still conceive and give birth to a child. To do this, you can perform an operation called trachelectomy. This is the removal of cervical tissue while preserving the body of the uterus. After such an operation, a woman will be able to have children in the future. In addition, the ability to preserve reproductive function is provided by an operation called conization. A conical fragment of the cervix is being removed, but usually these patients have a little difficulty having children. This needs to be evaluated individually. As for uterine cancer, there are patients who have the tumor removed through a small operation at a very early stage, and then they are given the opportunity to conceive with the help of hormonal therapy. But since these patients are usually hormone dependent, then we need to remove the ovaries, and after that, getting pregnant, unfortunately, seems impossible. For each patient, treatment methods are selected taking into account their effectiveness and safety based on the general state of the patient's health, age, genetic characteristics, lifestyle, and other factors. Turkish oncologists utilize international standards in their work, the identical ones that are utilized in prominent clinics in the United States, Israel, Germany, and Switzerland. Not all nations have equally developed medicine, and not all areas can oncology care be equally successful. In recent years, there have been noticeable changes in global stats on medicine effectiveness in different countries, and surprisingly, Turkey has made it onto the list of top medical tourism destinations. Not only due to states' multi-billion-dollar investments in this area, but also to convenient geographical location, good transport accessibility, pleasant climate of country, and very affordable prices for medical services compared to Europe. The quality of training of Turkish doctors is no longer doubted. For more info on the work of Turkish oncologists and cancer treatment in Turkey, visit our channel at this link. To choose a hospital that can truly provide the most appropriate medical care, it is important to know as much as possible about the specifics of different clinics, their capabilities, and how the local healthcare system works. Health does not forgive mistakes, therefore the treatment of foreigners in Turkey is handled by a special service company. Her employees know the specifics of this field. They are real doctors with real work experience in hospitals.
After a person submits a treatment request in Turkey, we, the coordinating doctors at Healthy Turkey, select the best clinic and doctors for him based on the diagnosis, preferences, and needs. As practicing doctors in Turkey, we know precisely how to perform it accurately, swiftly, and effectively. Next, we coordinate with the patient the treatment plan and constantly accompany him throughout the trip, as well as stay in touch for any questions even after his return home.
In Turkish hospitals, ESPs and oncology ones, patients are kept in very comfortable conditions. Now we have been allowed to show one of the wards where patients lie down to recover from cancer. This is our ward. It possesses all the conveniences for patients. As you can see, the patient has the ability to watch television. He possesses a mini refrigerator. Here is a telephone call to summon a nurse and medical equipment that is prepared for any emergency circumstance. There is a kitchen where you can not only make tea or coffee, but also fulfill any of your everyday gastronomic needs and cravings. Located within the ward, there is a designated area where patients and their guests can unwind and interact in a serene and cozy environment without any delay. Private toilet with shower cabin and all necessary toiletries. Such a level of service contributes to maintaining the emotional balance of patients and therefore the success of treatment and the approach to recovery. Turkish hospitals have a good understanding of this. After the operation, we carefully observe our patients for a duration of 3 months. We are observing to see if a new formation appears. Some patients after surgery we conduct radiation therapy or chemotherapy, after which we also always monitor their condition. Then for a period of 2 years, we carry out inspections every 3 months, and then we extend the intervals to 6 months. If cancer does not progress within a period of 5 years, the probability of a new formation occurring becomes low, and then we move on to receiving female patients once a year. Turkey is advantageously distinguished from other countries by a comprehensive approach to patient care. In other countries, you often have to pay separately for each manipulation. The company Healthy Turkiye is responsible for organizing visits of medical tourists to Turkey through the all-inclusive system. They work only with verified specialists in both medicine and hospitality and coordinate all their work for each patient. Healthy Turkiye takes all responsibilities upon itself, from consultations and agreements with the clinic and doctor to transfer, accommodation, immigration formalities, and translation of medical documents. Contact for consultation at this phone number or through chat on the company's website, address on screen. There is a lot of information on other directions of health tourism. Don't forget to subscribe to our channel and don't miss new videos about medical tourism and assistance to foreign patients in Turkey.